I enjoyed our Kaplan NCLEX review with you, and hope you got a lot out of it. I'm sure that you did. I don't know how you couldn't. Just wanted to say congratulations on completing the class, and you were a great class, interactive. I certainly enjoyed myself, and it helped me a lot professionally, and I thank you for helping me. I just want to encourage you to remember to, as you're going through the exams on the website, except for question trainers 1, 2, and 3, use the decision tree and start out with identifying the topic as we did in class. Make sure you know what the question's asking. If you can't identify the topic of the question, you're not going to answer the right question. If you need help identifying the topic of the question, look at the answers in the question. It might help you clarify what's being sought after. Secondly, once you've done that, decide whether or not it's a priority question, or if it's delegation question, or an rank order type question, or is it a teaching and learning evaluation question. I think I said delegation. And then move on from there and decide whether or not the next 2 through 4 steps are going to help you in the decision tree. But generally, the questions that are most or best, or those kinds of questions, you're going to go, and then step 2 is decide whether or not it's implementation or assessment. If you have assessment, then you need to decide, do you need a further assessment? Does the STEM have enough information in it, or do you need to do an assessment, or is there assessment in the STEM? That, remember, focuses on the nursing process assessment, which is first. If it doesn't, then you can rule that out if it seems that it doesn't apply. Then you're going to go to Maslow's and decide whether or not it's physical or psychosocial. If it's psychosocial, then you're going to rule that out because the physicals are going to have a higher priority over psychosocial. Then you're going to go to ABCs and see if that doesn't help you narrow the field in terms of your choices. So A, B, C, airway, breathing, circulation. And then from there you are going to decide what you have left over. Is it the right answer? Does it make sense? What's going to be outcome for the patient? Do you believe it's the right answer, and do you feel comfortable with it? And then you can go from there. So use the decision tree every time you have an opportunity. And then just remember the rules for delegation, the rules for who you're going to see first, whether it's physical in the hospital, or over the phone, or in the home health care. Those rules will really help you in terms of who you're going to see first, chronic versus acute, stable versus unstable, ABCs, so that, and then delegation, scope of practice, RN versus the LPN versus the unit assistant, not the unit assistant, but the tech or the nursing assistant. Well, I could say more, and perhaps I will. It's 3 minutes and 15 seconds, so I want to conclude. But thank you, and you're going to be well prepared for the NCLEX. And I know that you're going to pass, and you're going to do well, and I'll see you perhaps as a colleague in the weeks to come. Okay? If you need anything, you certainly can email me.